This is Damian McNamara at the Perioperative Medicine Summit in Miami Beach, and with me is Dr. David Lubarsky. Dr. Lubarsky gave a talk on changing physician behavior. Can you tell me what kind of incentives work the best in your experience?
Whenever you're setting up an incentive system, especially when it involves physicians, quality of care is always got to be the first part of it. You've always got to put the patient first and center in any incentive system that revolves around the clinical arena. But once you make sure that that is taken care of, then you can redirect attention to some more mundane goals around financial issues.
And you said when you choose incentives, it's got to be something that's going to motivate the physician. Is that right?
Well, right. So there are some real keys about setting up incentive plans. One is the physician must believe that the goal he's pursuing is worthy. And whether, and if it's a patient quality goal, that's pretty easy to convince them of. If it's a financial goal, it's a little more difficult. So you have to make it real to them and important to them by talking about how you're going to take the extra money and invest it back in clinical programs that matter to him and his patients. I think that's really important. The second part is making sure that the physician thinks that he can actually achieve that goal, that it's within the realm of possibility, that it's not out of his reach. And last and not least is that if you promise an incentive, you must deliver on it. The first time you renege on an incentive, you're shot for the next decade.
You've lost him at that point.
You have, and he'll tell all his friends, trust me.
Okay. Now, there are some small minority of doctors who are not going to follow the rules no matter what, and you've come up with some strategies in those cases. Can you tell me what works?
Sure. Well, I've been managing people for a long time. Before taking over as chief medical officer at the University of Miami, I ran the largest anesthesia training program in the world for a decade. And you see a lot of different behaviors. And almost everybody responds to positive feedback, occasionally negative feedback. Some don't, but are not really so bad, or they have so many redeeming features that you want to try and help them. So there are behavioral adjustment programs that they can be referred to. We use something called Pulse 360, which has been very successful at both here, Harvard, University of Michigan, and where people who are disruptive physicians are actually referred for 360-degree evaluation of how their behaviors impact how the medical team operates. And it's incredibly effective because physicians really respond to data that shows that they're not as good as they think they are. And when you show them this, and you show them how and this is part of the good part of the program, it tells you instead of doing this, maybe you should think about framing your behaviors in a different way, and gives you a positive example of how to do it. It's part of the coaching program. So it's 360-degree feedback and coaching, and then the physicians have a periodic assessment of how they're doing, and they see themselves improving. It actually really works. I have saved some physicians that I thought would have to be let go, and they have become incredibly productive and valued members of the faculty again because they had the feedback that allowed them to perform to a higher level.